An 18-year-old drug user presents with fever. He has a new murmur and lesions on his fingers. What is most likely responsible? Staphylococcus aureus. The patient has splinter hemorrhages. Is Staphylococcus aureus bacterial endocarditis rapid or insidious in onset? Rapid. It has a high virulence and results in large vegetations on previously normal valves. What is the most common cause of early cyanotic heart disease? Tetralogy of Fallot. Do right to left shunts cause early or late cyanosis? Early, much of the circulation bypasses the lungs and is not oxygenated. Do left to right shunts cause early or late cyanosis? Late, cyanosis does not occur until the effects of increased pulmonary pressure become significant. A patent ductus arteriosus can be closed by using what drug? Indomethacin, although surgery is sometimes required as well. What is the order of frequency for the three most common causes of left to right shunts? Ventricular septal defects, atrial septal defects, patent ductus arteriosus. What is Eisenmenger syndrome? In Eisenmenger syndrome, a left-to-right shunt overloads the pulmonary circulation and causes increasing pulmonary pressures. When pulmonary pressures equal systemic pressures, the shunt switches to right to left and cyanosis ensues. The 5 Ts of right to left, cyanotic, shunts in congenital heart disease are comprised of which diseases? Tetralogy of Fallot, transposition of the great arteries, truncus arteriosus, tricuspid atresia, and TAPVR, total anomalous pulmonary venous return. What are the heart sounds associated with atrial septal defect? A loud S1 and a wide, fixed split S2. What is persistent truncus arteriosus? Failure of the aorticopulmonary septum to divide the embryonic truncus arteriosus into the pulmonary trunk and the aorta. What is tricuspid atresia? Absence of the tricuspid valve in a hypoplastic right ventricle. How do neonates with tricuspid atresia remain viable given their severely compromised circulation? In order to maintain viability, both an atrial septal defect and a ventricular septal defect are required for babies with tricuspid atresia. What is total anomalous pulmonary venous return? A disorder in which the pulmonary veins drain into right heart circulation, i.e., the superior vena cava or coronary sinus, as opposed to the left atrium. How can an uncorrected ventricular septal defect, atrial septal defect, or patent ductus arteriosus result in progressive pulmonary hypertension? They can cause compensatory vascular hypertrophy, which results in progressive pulmonary hypertension. Which congenital heart diseases can eventually result in Eisenmenger syndrome? Uncorrected atrial septal defect, ventricular septal defect, or patent ductus arteriosus. What are two physical findings associated with Eisenmenger syndrome? Clubbing and polycythemia, both are due to hypoxia secondary to right to left shunting. In which direction is blood shunted in Eisenmenger syndrome? How does the condition change over time? As pulmonary hypertension increases, the original left to right shunt reverses into a right to left shunt. Tetralogy of Fallot is caused by the displacement of what structure during embryogenesis? The infundibular septum. It is displaced anteriorly and superiorly. Name the 4 clinical features of tetralogy of Fallot. Pulmonary stenosis, right ventricular hypertrophy, overriding aorta, and ventricular septal defect. Remember, prove. In patients with tetralogy of Fallot, the severity of which heart lesion determines the patient's prognosis. Pulmonary stenosis. In tetralogy of Fallot, why does right to left shunting occur? Because the increased pressure in the right ventricle, caused by the stenotic pulmonic valve, causes the blood to be shunted through the path of least resistance, i.e., to the left ventricle through the ventricular septal defect. How does squatting help patients with tetralogy of Fallot improve their symptoms? Squatting compresses femoral arteries, which causes increased arterial pressure, which in turn reduces right to left shunting and causes more blood from the right ventricle to enter the pulmonary circulation. What is the chest X-ray finding that is associated with tetralogy of Fallot? A boot-shaped heart, which is due to right ventricular hypertrophy. What is the prognosis for infants with detransposition of great vessels? They die within the first few months of life if their condition is not surgically corrected by adding a shunt. What is detransposition of great vessels? A congenital heart disease characterized by an aorta that leaves the right ventricle anteriorly and a pulmonary artery that leaves the left ventricle posteriorly, causing separation of pulmonary and systemic circulations. What condition must be present for a fetus with detransposition of great vessels to remain viable? The presence of a shunt to allow adequate mixing of pulmonary and systemic blood, i.e., a ventricular septal defect, atrial septal defect, or patent foramen ovale. In terms of embryology, what is the cause of detransposition of great vessels? Failure of the embryonic aorticopulmonary septum to spiral. What cardiac valvular disease can result from coarctation of the aorta? Aortic regurgitation. Thank you for watching. Subscribe to learn more.